Hello, I'm Rowan O'Doherty, and I am the president for D&HHS, Deaf and Hard of Hearing Services, and I'm here to help the Kent County Health Department and the facts or frequently asked questions that are being dispersed at this time to help the deaf community to completely understand what's going on with the vaccination process. To answer some questions about how the vaccine actually works, there are currently 2 vaccines, one by Pfizer and one by Moderna. And there's a question whether there is a live coronavirus in the vaccine that causes the person to become sick, and that is not true. It is a newer technology that is using the messenger RNA or mRNA that is spliced and put into the mixture, helping the body to then recognize, the RNA will then recognize the coronavirus and then produce protective antibodies against the coronavirus. Suppose you have a group of 10 people, 9 of them have been vaccinated and 1 has not yet been vaccinated. And the coronavirus has spread and it cannot find anybody who hasn't been vaccinated because there are 9 people that have been vaccinated from a group of 10. So that is how we have community protection, and we're reducing the rate of person-to-person transmission. The Pfizer vaccine has 4 ingredients. The first one is the mRNA, which is the main ingredient that helps the immune system produce antibodies that will protect the body from becoming sick. The second is a lipid, which would be like a type of coating or a shell of fat that protects the mRNA from destruction as it's being stored. The third ingredient is a potassium chloride, which works with the acid and the base to maintain proper levels of acidity. The fourth ingredient is sucrose. It's a sugar that stabilizes the mixture. Now the second vaccine, the Moderna vaccine, has almost the same ingredients. It also has the main ingredient, the mRNA, which, remember, protects the body, makes it immune, and helps it to produce antibodies. It secondly has also a lipid, which is a coating or a shell of fat that protects the mRNA from destruction while it's being stored and delivered to the cells. There is also a potassium chloride or a salt that helps maintain proper pH, as well as a sucrose or a sugar that stabilizes the mixture. So remember, we have the Pfizer and the Moderna vaccines, and those are pretty much the same. The technology is very similar. The mRNA, Pfizer has sliced it in a different area than Moderna, so that is different in that area. They also use a different lipid and a different potassium chloride, but remember, those 2 vaccines do work the same, and both are equally effective, as well as having the same similar kind of side effects, temporary side effects such as fatigue, headache, body aches, and so on. those are similar between the two vaccines. And if you're wondering how much the vaccines are going to cost, they should be free. They have been purchased by the federal government with taxpayer money, and they are being dispersed at no cost to Americans. Also, some of the vaccine providers, they are charged a service fee for administering the shot, but that fee is covered by insurance. So out of pocket, there is nothing that you have to pay. And if you have no insurance, you will not have to pay either. It's covered by a government relief fund. So maybe you've heard of some of the variants that have been coming out of the UK and South Africa. There are some variants to the coronavirus that have shown up, but data has shown that the vaccine manufacturers have found their vaccines to be effective against these variants. Of course, those who are developing the vaccines are still keeping watch during this pandemic for other variants that may not be protected by these vaccinations. And if that does happen, then they would offer a booster shot, which would then help protect those who have been vaccinated from these other variants. Deaf and hard of hearing services, we provide a variety of services such as language development in children, hearing aid technology, and advocacy, counseling, a plethora of services for our deaf community and hearing community as well. You can find us at www.deafhhs.org.